Can you give us an overall view of where Israel is at in terms of the vaccine program and in the context of these third boosters that we're seeing at the moment?
So we have indeed a very high vaccination rates. In many ways, we are a model country. We are very proud of it. What can be seen in Israel that vaccinations are not enough. Need to be a multi-layer approach where we have vaccinations that, of course, are very effective, but we saw that over time there was a waning immunity. In the last few weeks, we started to vaccinate first those who are over 60, then over 40, and today there is another discussion of the expert committee about reducing it even to over 30, and we see already very good results. There is definitely a higher coverage protection for those who are getting the third dose. We also see that the side effects are very similar to the first and second dose. Another interesting new approach is that from yesterday, after studies showing the gaps in vaccination rates in Israel according to socioeconomic status, we are much more proactive and getting to the houses, especially in villages, including in the Arab community, to increase the vaccinations rate. We have a very high number, still very high number of cases, widespread transmission because of the Delta variant. But on the other hand, we are strengthening the public healthcare system, especially hospitals, but also home hospitalisation by the community. We have 4 health funds, non-profit. So the combination of all of it, together with the Green Pass, together with some limitation on large gatherings, especially indoors, all of these should be measures that are good for opening schools. There is a special program for that about
Okay.
measuring also serological tests and also getting into the high holidays, the Jewish high holidays. So very challenging times, but the idea of learning to live with the virus, not by being passive, just the opposite, by having an approach,
Okay.
including vaccination and other things, that's the main measure.
And explain to us what measures are in place. I think you alluded to it, the Green Pass, in terms of those that people who have been vaccinated. Does that afford you more freedoms, more rights?
The idea of the Green Pass is, first of all, to open the economy. Of course, it's also nagging people to be vaccinated, but in terms of the ethical aspects, people that are not vaccinated can, either because they can't, like children below age of 12, or for other reasons, they can be tested. Israel opened many rapid tests that are available everywhere. And I think if you take the ethical consideration from all parts, I think it's a proportionate measure. We need to remember that vaccination, people that are vaccinated, they also have the right to be protected. And I think
Yeah.
having the Green Pass is a good idea, and it's also bringing more people to be vaccinated. But this is not the main
Okay.
reason for doing it.
And tell me, what's the treatment of children? You said those over 12. So at this stage, children, teenagers are being vaccinated. Are there any plans to lower that age as well? Can you give us an update on how Israel is treating the question of children? Because it's a very much a relevant and current question that Australian political leaders are looking at.
Right. So there were many debates here in Israel and very long considerations about the data. Israel actually gave the signal about the issue of myocarditis, but we see that this is only about 1 to 10,000, and more than 95% of it are very mild and transient. This is especially among boys, second dose. And I need to say, I myself, we have 3 children. The youngest is 14. Was vaccinated about 2 months ago. And there was a big debate about should we have children vaccinated at schools. Schools vaccination, of course, is very old here in Israel as everywhere. So we are doing vaccinations also in the city squares with youth movements. trying to give incentives as much as we can, including at schools, including also mass serological tests. So children are now getting more vaccines. We have about 45% of them being vaccinated, and I think this was a very successful program. And I think that still, even though that children COVID is less severe than for adults, it's much better still to be vaccinated, and both on the personal level but also on the community level to stop the spread.
Professor Nadav Davidovitch, thank you very much joining us there live from the Ben-Gurion University of Negev. Appreciate it.
Thank you.